UC Medical Center is canceling all elective surgeries that require hospitalizations. It's just one of several maneuvers local hospitals are taking because of the sharp rise in COVID hospitalizations. David Winter is live at UC Medical Center. And David, what are hospitals doing to make space for the influx because of this pandemic?
Well, Megan, the surge is hitting all of the hospitals in this area hard, but it's hitting UC especially hard because so many of the critical COVID patients are transferred here due to the fact that UC has so much specialized equipment.
We're running into more and more difficulty when it comes to capacity because our numbers have definitely ramped up over the past couple weeks.
UC Health would not go on camera today, but did provide this video taken by staff inside its COVID unit.
Our capacity is really limited. We've had a hard time bringing in these critically ill patients from other hospitals, and not only COVID, but other issues, liver disease, liver failure, renal failure, other kinds of respiratory failure.
Because of this surge, UC is taking the following actions. Effective immediately, only medically necessary time-sensitive cases, inpatient and emergency cases, and outpatient elective cases that do not require admission will be performed. Secondly, starting tomorrow, UC Medical Center will repurpose its cardiovascular recovery unit as an 8-bed surge intensive care unit. And still in effect since November 15th, external transfer requests to an ICU will require advance approval, and patient appointments will be moved to telehealth where possible. At St. Elizabeth Healthcare in northern Kentucky, all surgeries from the Fort Thomas campus are being relocated to other surgery locations to maximize additional capacity for COVID patients at one location, which is in Fort Thomas. At Christ Hospital, elective procedures are canceled on a case-by-case basis if the appropriate inpatient beds are not available. Hospital officials are also evaluating transfer requests on a case-by-case basis. And while the frontline workers are doing their best, they say they are exhausted.
It's morally exhausting when I go to Home Depot to pick something up for home and I find no one wearing a mask. Everybody walking around like nothing's wrong.
Well, we called on the Health Collaborative. That's the group that coordinates the efforts of most of the hospitals in this area. And this is what they tell me. They say that hospitalizations have grown exponentially over the past month. Currently, 1 in 4 patients in Southwest Ohio hospitals, 1 in 4 are COVID positive. That's compared to 1 in 8 just 3 weeks ago. And then they also told me that the number of patients within the region's ICUs is the highest that it's ever been. At UC Medical Center, David Winter, back to you.
David, thank you. The Health Collaborative also says the best thing the public can do to help: wear a mask, socially distance, and stay home as much as possible.